So nobody, absolutely nobody likes getting knee pain. But guess what? When that knee pain sets in, we wonder if it's a couple of different things. It could be just a basic strain or sprain to the knee, or it could be actually a bursitis to the knee, or it could be maybe a flare-up of our IT band. Now, for some of you, you may have been recently diagnosed with patellar tendonitis and wondering what it is.
It's about getting to the root problem.
Hey everybody, it's Dr. Heather, your virtual sports chiropractor, and that is something we're going to talk about in this video, specifically about patellar tendonitis and what it is. So what we want to do first is look at the anatomy. Now you guys, as you know on the channel, I'm really big on education, and I want you to understand what muscle groups we're going to be focusing on when we address something like patellar tendonitis. Now, if you've gone ahead and Googled your symptoms and you've kind of came to the conclusion that this is what you have, that means then we're addressing the vastus muscles, not so much the rectus femoris muscle that is the main quad muscle, but actually the three muscles that are underneath that really play into patellar tendonitis. Now, with this itis, and as you know, itis means inflammation, we want to go ahead and do the RICE protocol first. So if you are noticing some swelling due to this condition or irritation underneath the kneecap, I want you to go ahead, grab that ice pack, and put the RICE protocol into play. Now, if you haven't caught my video on how to make an ice cup, you're going to want to go ahead and use an ice cup massage, as it is very helpful with this type of injury in the sense of using ice for recovery. Now, like I said, we're going to ice it down, then we're going to go ahead and do some nice cross friction massage around the knee to really help break up any inflammation, any scar tissue that may be developing around and underneath that kneecap. So once we've gone ahead and we've gone and done our RICE protocol, and we're kind of at that 72-hour mark from the injury, we want to then go ahead and look at doing the exercises. Now, when we go through these exercises, they are very specific to patellar tendonitis. So remember, if you have comments or questions, please drop those down below. But let's get to those exercises now. So we're going to get into the exercises that you can start to implement for patellar tendonitis, thanks to the fact that now you're out of that 72-hour period. So what we're going to do first is we want to focus on stabilizing the patella. So the patella, as we know, is a free-floating bone, sits right here. Our quad muscle comes right over the patella, okay, and attaches to the tibialis tuberosity here. Now, when we look at patella tendonitis, yes, we're addressing the rectus femoris muscle, but like I said to you, we also want to start addressing the vastus muscles as well to really help in creating more stability to the knee. Now, the first thing you're going to do is create some stabilization to the patella. And how do we do that? Well, it's very simple. As you can see, Joey's just kind of chilling out here on the bench. He's going to go ahead, he's going to flex his foot towards him, allowing for the rectus femoris muscle to engage, creating stability around the patella. And he would just hold here for about a 30-second count. Then he would let the foot relax. So it would just relax the knee entirely. Then he would go ahead, flex the foot again, allowing for that muscle to contract, stabilizing that patella. This is one of the exercises you would initially start with first, just as you're getting out of that 72-hour period and the inflammation has died down. Now, the next thing we want to do is look at stretching out the quad. Now, the next thing we want to do is we want to start looking at really stretching out the quad. Now, it's really important when we stretch out the quad that we need to make sure that the heel is actually coming more towards the butt, and we're not letting the knee itself kind of start to track out on the side, because that's going to actually start, engaging more of a sensitivity inside the hip. So we want to really make sure that the heel stays focused on the glute that we're working on. So if we're on the right heel, right glute, same on left. So what we're going to do is we're going to use a band really simply, and we're just going to take the band around the ankle, because we're keeping this really nice and gentle to start. And then I'm going to have Joey just grab with his left hand the band, so we're using opposite, to allow for the quad to start to get a nice stretch. Now, initially, I don't want anyone to really over pull when we do this one for patella tendonitis. Try to keep it just stabilized, keep it right here, keep the quad on the bench. Don't lift up just yet. if you're noticing that you're kind of like, all right, I feel a good stretch, but I want a little bit more, start to allow for the knee to come up off the table and allow for that stretch to happen a little bit further in the front part of that leg. But do be careful. Watch that we don't increase our lumbar curvature here by hyperextending the back. Hold for about a 30-second count and then relax, let it come off with some tension, and you can repeat from there. So the next exercise we're going to do for patella tendonitis is actually one that is seated. So we're going to go ahead, we're going to take our right leg, we're going to bring our knee up towards our chest. Don't hold on to it though. From here, what we're going to do is we're going to pretend that there's a soccer ball in front, and we're going to simply kick the lower leg out and bring the leg back. But I want Joey to go ahead and really flex the foot towards him and really start to engage that quad as he does this exercise. So again, nice and easy, just going ahead and kicking that lower leg out. Now, if you're noticing still some discomfort around the knee, we can change this one slightly by just making it a straight leg lift. So go ahead, put the leg straight out on the floor, pull the toes towards you, and just simply lift the leg up and down in a straight leg manner. So these are two options that you could do for some leg extension work. Now this next exercise is actually one that I specifically created for those who suffer with knee pain. Now this is a great one that you can do for patella tendonitis. And what we're going to do is we're going to lay first flat on the floor with our feet flat. Second piece of the puzzle, foam roller or yoga blocks, going to go in between the knees. Then from there, you're going to go ahead, get up onto the toes of the feet, so the ball. And from here, we're going to pretend that we're going to start squeezing the foam roller, so gently squeezing the roller, allowing for our hips to stay in a nice neutral position, our core to be activated. Then we're going to go ahead and start lifting our tush off the floor and back down without hyperextending our back. Now this is going to do is really start emphasizing hamstring, glute, and calf firing to take tension off of the patella tendon, allowing for the other muscles to help in continuing to stabilize the knee a lot further. This exercise, you're going to go ahead and you're going to repeat up to 20 times. Okay, so the very last exercise that we can try, and this is a very advanced exercise, so if the knee is definitely starting to feel really better, this is one that you can try for patella tendonitis. You're going to go ahead, find a supported wall, come scoot down into your wall sit position, right there. So making sure the knees are at a nice 90-degree angle. Take your foam roller, place it between the knees, squeeze the roller, lift the toes up. So you're driving, nope, other way. You're driving all the emphasis into the heels. So really trying to now push all the way into the heels. So keep these toes up, squeeze that roller, really drive the weight into the heels, working glute, hamstring, quad, and your tibialis anterior, which is going to help again with the patella tendonitis. Hold this for about 30 seconds. So like I said, nobody likes when knee pain sets in, but now you have a true protocol that you can put into place if you're suffering with something like patellar tendonitis. Now, for more great videos right here on the channel that would complement this one, I want you to go ahead and click on those videos that I've left you on the screen here. And don't forget, as always, subscribe to the channel today. I'm Dr. Heather, your virtual sports chiropractor, and I'll catch you in the next video.